One. Well, welcome, listeners, and I'm especially excited today because on this episode of We Love Our Heart, the podcast, I have no other than Angela Hartley. We've known each other for a few years. Hi, Angela. And she is, how can I say this? She's going to introduce herself, but she's very much at the coal face of dealing with heart patients, people who've had a heart attack and people who are probably trying to prevent another one as well, fair to say. But I want to hear from Angela what she does, why we're here today, what we're going to talk about. Let's go, Angela. How are you?
I'm great. Thank you so much for having me. Great to see you again and nice to be on your podcast and yeah, be able to share my experience with your listeners. So, cardiac nurse by background, so working in hospitals, kind of pre-op. So, I used to do pre-assessments where I would sort of book you in for your maybe your procedure, your bypass, your surgery or your stents, talk you all through that. And then I worked also on the ward. So afterwards, wake you up. How are you? Talk you through how it all went, look after you while you were in hospital, and then send you home. But my most passionate job I've ever had is all in cardiac rehab, and that is seeing people afterwards. So after you go home, what happens next? How do I get back to exercise? What should I do differently about my lifestyle to make sure this doesn't happen again? So I'm really passionate about sharing as much confidence in your body as I can of what you can and can't do, how to get back to normal again, what is normal, and yeah, sharing that as much as I can. So that's why I do what I do.
Brilliant. I love it. And it's so on point for what we're trying to do with We Love Our Heart to help people obviously not have a heart attack in the first place. That would be very cool if so much time was put into that kind of prevention. But basically, then there's always people like me who've had a heart attack, and then it's like, how much help do I get? What do I do now? What is sensible? What is not sensible? How can I move my life forward? And as you know, Angela, we've been talking for 4 or 5 years now, and my life has pretty much moved forward. I'm as healthy as I can be right now, given what I've been through. But it's not about me. I want to be able to help other people, and which is what you do basically. So I'm going to kick off with a couple of thoughts. Right.
Go
Just,
for it.
and I know that I was not the typical heart attack patient. I'm skinny, I'm fit. I thought I followed a good diet, etc., etc. But let's just find out what are the most types of people that you see? Are you seeing the classic, oh, overweight, smoking, whatever, or are you seeing more and more, shall we say, outliers like myself in that respect?
A bit of everything, to be honest. So there's always those two categories of the classic ticking all the boxes, could have possibly been prevented. And then there's this other area of people where, like yourself, it's why me? I was doing everything right. I was fit. I was healthy. So still both. We still know that the highest risks are things like smoking, things like high blood pressure, things like high cholesterol, which not everyone does have. So there is still that proportion of people who don't tick any of those high risk boxes and unfortunately still do have a heart attack. We are learning more and more. There's more and more research about other nuances. So, different types of cholesterol testing, things like glucose, we're looking further into to see the inflammatory process and the impact of that. So, yeah, a bit of both, unfortunately. By nature of what I do, where people often come looking for help, I'd say we do see a lot of younger, fitter people, unfortunately.
Oh, right. Okay. The one thing, just staying with that topic, one thing I'm curious about as well. Let's be honest, I had a sudden cardiac arrest, so there's no way I can remember what actually happened to me leading up to it. How did I feel? Did I have the classic pain in the chest or whatever? I was just gone. But I just want to ask you, do you what do you see as the classic symptoms of having a heart attack, or the interesting symptoms of having a heart attack, where people might not realize it could be a heart attack they're suffering from?
I think we could need to go maybe a step before that is what are the subtle signs before you get to the heart attack point? Because there are often some early warning signs that people may put off as other things. They say, "Oh, it's not that bad. I don't need to see the doctor. I don't have time yet." Or, my doctor said I'm fine. Don't worry about it. So even before that point, those subtle signs of things like fatigue, you may, especially if you're fit and healthy, you may notice, "Oh, I'm just not running as fast. Everything's a little bit more effort. My heart rate's higher." Some of those real subtle things where you think, "Oh, I might have a cold, or I might just be a bit tired this week." But if those things are continuing, they are some subtle signs your body is working harder to do the same amount of effort. So some of those things, the more obvious ones in the lead up to a heart attack, things like breathlessness. I'm huffing and puffing going up the escalator at the tube station, or I might be more tired walking up a hill than I used to be. They're kind of the classic, the heavier breathing. Things like getting sweatier early, night sweats as well, another subtle sign. The body's trying to cope with something, and it's not able to. And then the classic thing that we do think of is chest pain. And chest pain varies. Obviously, at the end event at a heart attack, it can be very severe. People describe it as crushing, like an elephant sat on your chest. Very severe, could radiate to the jaw, down the arm, back pain. But before that, there may be those subtle twinges where, okay, yeah, I do feel like I'm a little bit achy in the chest. Maybe I did too many press ups, but actually it's only on the left side, or it's not related to upper body exercise and you're still getting those twinges. So ideally, we'd be getting checked out super early with some of those subtle things, but they are a little bit harder to pinpoint for many people.
Brilliant. I want to just pick up on two or three things there that you've said, which is fantastic. Yes, some of the early symptoms, but I've had, or people who've come to me have talked about some of the things you mentioned, jaw pain, as one thing, shoulder pain as another thing that was the lead up, which you kind of confirmed me there. I mean, that's, like virtually as you're having a heart attack, maybe. And it's very interesting. Yes, when you've got these little twinges, you should go to your doctor. Now, we know as a gender thing, men are typically much less likely to go to their doctor for some of those illnesses. If I felt I couldn't do as many press ups as I normally do, I'm not going to go running down the road to the doctor straight away. But nevertheless, we'll get back to that. But one thing I am interested in as well, and I'm sure you're in a much better position to say than me, is that women are often misdiagnosed. In
Mhm.
fact, isn't that the case?
Yeah, absolutely. And it is a real shame it's still ongoing in that respect, often because the signs are a little bit different. So sometimes women present with more fatigue, more just, I don't feel quite right. I feel more anxious, may have palpitations, maybe nauseous. So there are some different signs. Again, it can also be other things. Often it coincides with perimenopause, postmenopause. So there's a lot going on where it can be other symptoms of other conditions or symptoms of perimenopause itself. So it is very complex and it is tricky for doctors. So there is that element of, okay, I've had a couple of checks. They told me to go home. Everything was okay, but I still not quite right. It is important to keep pushing and go back and say, look, I am still suffering with some symptoms. Can we do a few different tests, or what else could it be? And women are often dismissed because, again, similar to men, we put things off. We're busy, might be caring for elderly parents and young children or teenagers. There's a lot of stress going on. So we often put it off thinking, well, I'll go another day. But it's important that you do get yourself checked up regularly, as and when you can, or if there's anything wrong.
Okay, super. And on that point as well, what are the typical metrics that I myself could check? I mean, for example, yes, I've got my Garmin here. This I, do all my sport with my keep an eye on my pulse rate. I watch my rest pulse overnight, see what that's doing. I've also just around the corner, I've got my blood pressure monitor, which I probably check two or three times a week just for reassurance, basically. What do you say? What is a sensible thing to do without being over obsessed about
It is a
metrics or
balance.
wearables?
Yeah, and it is a balance because sometimes Garmin tells you, oh, you're too tired, don't go out today. And so it's trying to read your own body as well to know, well, just because my blood pressure monitor says everything's fine Doesn't always mean it's all fine on the inside because other things could be happening. You're right that resting heart rate is a really good marker. Is it the same over time? Is it maybe, fluctuates a little bit by 4 or 5 beats, but in general is about the same. If that's suddenly up by 10 or 20, you'd be thinking about why. Then the blood pressure, obviously, long term is really important to say, am I giving myself the best chance for those healthy arteries in the long term? So keeping blood pressure at a nice, normal, low level. But if there is an acute change, so if it's suddenly very high, that is a real urgent worry and you should get checked out. There are so many different like gadgets these days. We've got all the aura rings, and it can do other things like sleep. I guess there's a balance. If you love data and you love tracking, and if someone tells you you're doing really well, that's a real motivator. I'd say go for it. If you are the type who's a bit more prone to health anxiety and a bit more, oh my gosh, it said I only slept for 5 hours, that's a worry then, because if you feel fine, it doesn't matter. So it's trying to balance the two between, like you say, we don't want people to be anxious and rushing off to say, my Garmin told me my HRV is low, but actually I feel good and everything's fine. Versus actually can pick up some subtle things like the heart rate being up, or you going for the same jog every week for the last year, and suddenly your heart rate's much higher. It might pick up on subtle things like that.
Ah, so cool. Because actually, one of the things I wanted to mention as well was sleep, and the importance of sleep. I mean, I think you're absolutely right there as well. It's easy to become over anxious about reading some of the metrics that are on offer now, whether it be an Apple Watch with ECG and all these other things you can get into as well. One of the things that I tend to focus more on these days is quality of sleep. I'm not wearing a wearable. Because again, I've also read that they're good, but they are only proxy results for they take your pulse rate and blood oxygen and then extrapolate that into sleep scores. So, okay, but you're absolutely right. I can 100% judge if my rest pulse is nice and low during the night. Generally, almost certainly coincides with what I consider to have having had a good night's sleep.
Yeah. And we all know when we haven't had a good night, you're tossing and turning, you've got, a meeting on the mind for the next day and you had hardly any sleep. And that's okay every now and then. I think as a population, we do need more sleep. We need better quality. We need less alcohol. We need to go to bed earlier. We need less blue light. We know all of that. It's just doing it consistently. And it's working out for each person what is your best routine and making sure you stick to it most of the time, and not being super anxious if you fall outside of that because you had a late night or you've got a busy day tomorrow and you're a bit stressed and it's on your mind and you sleep terribly, because the more you worry about sleep, the worse it gets, right? So I think you're right. A little bit of monitoring is okay. I think in general, getting to bed earlier for most of us, getting up at a similar time, doing exercise early in the morning, or at least getting outside, seeing the light. So some of that is obvious, right? And some of that is, yeah, if you need a tracker to tell you that, maybe that's helpful and that's motivating. So a bit of both.
Okay, cool. Well, I'm going to make a little confession because I'm not perfect. And I mean, well, you mentioned it. You're so good at mentioning everything I want to talk about. We mentioned alcohol there, for example.
Mm.
Yes, I had a year where I had no alcohol at all, managed that no problem at all. Otherwise, I've always been a bit of a social drinker, a
Mhm.
lot less these days, I must be honest. But let's just talk about sleep. I can tell you exactly if I stop eating, let's say 6 o'clock in the evening, I had a low carb day. Not every day, but many days are low carb. I stop eating at 6 o'clock. I don't drink any alcohol. I can tell you now, my rest pulse goes down to 45, 46 at night. If I have something to drink before, if I indulge myself in spaghetti bolognese, then my rest pulse is 52, 53. For me, it's as clear as that. It's
Yeah.
really, really interesting.
And that's amazing because you've worked it out, right? You go, for my best quality sleep, I need these conditions. I can't have a huge carby meal because, that blood flow to the stomach is taking that bit more effort to digest. I'm not going to sleep as well. I might get a bit of discomfort in the old esophagus, the stomach's a bit fuller. but I guess it's balancing that with enjoyment and saying, well, I absolutely love spaghetti bolognese and my life would be horrible without it. Or, my mother-in-law cooked it, so I couldn't say no. So some of it's balancing it with, yeah, if we sleep a little bit poorer, occasionally that's fine. But working it out is brilliant. And same, you have a year off alcohol, hopefully you go back to it and you go, oh, I forgot about this. I woke up with, a few flutters, or I'm a bit cranky the next day with my family.
Mm.
Sometimes you crave sugar the next day. So it's trying to work it out for ourselves, and working out what your limit. I can have 2 beers, not three, or I can have this type of wine, not that type of wine. And you can really pinpoint it then.
Okay, perfect. Let's move on a little bit about let's talk about exercise. I mean, obviously, you're talking to a broad spectrum of people who've maybe had an event, and they've each you have to, I guess, deal with them individually. But what kind of generally is the sort of thing that we're talking about? You mentioned already, which is something I do as well. Get out in the morning. I get up early. My darling wife's a teacher, so we're up at 6 o'clock every day. I make breakfast and off I go for a walk or something like this. Um, Tell me, what do you consider, what do you recommend as a reasonable exercise?
Yeah, it will change through different phases of where you're at in terms of the heart event. So the key really is the first 3 months of sort of sleep, eat, walk, repeat, and build up a little bit of light cardio during that time. You can start to add some light resistance, and then at that 3 to 6 month point, it's building up even more cardio. You may start to do a slightly harder amount of exercise, maybe some intervals if you're able to, and then harder resistance exercise. And then the 6 month point onwards will really depend what heart condition you have. Is there any residual damage? How hard can we start to push it? Is there any reason not to push it? And that would be things like heart failure, any large area of scarring where you shouldn't really be pushing it too much. So that's finding out more from the doctor about that long term. What can we get back to? But walking, steps, get your walks in, add a bit of light cardio, bit of light resistance, and just gradually build over sort of 6 months.
Brilliant, brilliant. Now, and the last thing, well, not the last thing, but one of the things I wanted to talk about as well was the medications. Obviously, a lot of people come to you on, shall we say, a cocktail of medications to begin with, potentially not. What are the, can I just ask you first of all, what are the most common medications that you'll see?
Yeah, if we're thinking of heart attack, the main ones that we're thinking of are the aspirin, and there usually will be a second one, which is a very similar medication to aspirin. And there's a couple of different names for that, including clopidogrel, ticagrelor, prasugrel. They're usually for 12 months, and then you would usually stay on aspirin or one of the others for life. And that's to help prevent the blood being sticky, whether you got stents or whether the heart attack was caused by some clotting. So that's an important one to keep to stick to for life. The second one that is most commonly prescribed is your statin. That helps for a number of different reasons. It helps get the LDL cholesterol down, helps stabilize plaque, helps prevent inflammation in the artery wall. So that's a good one. That is usually for life. And if people have side effects or they're worried, they can often find alternatives to that. The next ones are depending on if the heart attack caused some damage and we want to help that heart muscle, especially in the first 12 months. So they're ones like ramipril and bisoprolol. So two different families of drug, but they help with the remodeling. They help keep the heart calm. They help prevent arrhythmias in that period where the heart is scarred and a little bit fragile. So again, at least for 12 months, and then review, do we still need them? And then the rest are things based on whether you need extra support like blood pressure, diabetes, and anything else that might need to be assisted.
Okay, well, Angela, you know that from my point of view, I've tried to steer away as much as I can now from the reliance on medications, and I do different things. But I'm not gonna challenge you on that because I understand that a lot of people they are not in the position where they say, "Oh, I'm going to stop taking everything now. I don't believe in this." You know, I understand what it's like when you have a heart attack, when you're trying to get back your life, so to speak. You're looking for a life raft to cling on to, and I understand exactly how the medical system provides that. So I'm not going to knock any of that. It's an individual choice at the end of the day. And I would be probably be right in saying you don't even prescribe drugs, do you?
No,
You're
I'm not a medical
monitoring.
prescriber, and the guidelines are there as guidelines. It is personal choice at the end of the day, but it's understanding the benefit versus the risk of taking it versus not taking it. How do
Yeah,
I feel on it? But if people aren't doing the healthy behaviors and not taking medication, that becomes an extra risk.
yeah.
And it's also understanding some of it is mechanical and some of it is inflammatory. So it's trying to work out what is the actual mechanism of heart disease and what can I do personally to prevent that for as long as possible. And medication will play a part in that. And some medications were natural. It's just that they're now developed to become, a pharmaceutical grade of that.
Aspirin, for example, is willow bark, I
Yeah,
believe.
exactly. So it started out where they
I
worked
think it
out.
was Bayer, the German company Bayer, that was the first thing that brought them into pharmaceuticals. But
And it's a very cheap medication. It's usually very well tolerated, and it's something that can save lives. So it's trying to balance, yeah, what is the reason for not taking it, and what is the concern, and is there anything that can be helped? And if you choose not to, what else is an alternative, and what else has research behind it? But yeah, absolutely patient choice, making sure you're not having side effects, dealing with that, changing them, etc.
perfect. Now, just to throw a little curveball in here. Don't worry, we talked about this before. We talked about, and my opinion is, well, I'm on the fence, but I'm coming down on a different side now on the range of GLP-1s, the Ozempics, and the type 2 diabetes drugs that are out there at the moment. I mentioned that just because you mentioned that some cardiologists are now prescribing this
Yeah.
for presumably weight loss.
Yeah, in the UK, they've just released a particular type. I can't remember which one it is. I think it might be Wegovy for prescribing for exactly that, for risk reduction in cardiovascular disease, regardless of obesity. So there is more and more research saying that these medications have better cardiovascular outcomes and therefore should be used amongst people who are at high risk. They have lots of benefits, and the weight loss is one of them. We all think of it as a weight loss jab, but actually, if it was a tablet, and we said, right, this will reduce your risk of diabetes and heart disease, well, why wouldn't we, accept that and encourage it and utilize that? Yes, there's obviously side effects, and we've got to be careful with certain populations and certain medical histories and things like that. But on the whole, it has some really positive benefits.
Yeah, no, I just want to say that I've seen it from a personal effect that it's had. I hate to mention it, but my father-in-law and him losing a lot of weight has uh, added benefits to his life. He has more self-esteem. His wife finds him more attractive. He's being able to do things he wouldn't have normally done, 30 kilograms heavier. So I see, my initial knee jerk was, oh my God, what's happening to society? But I see that there are some positive benefits for many people of taking these kind of drugs. And I was interested to hear that you even said that cardiologists are using them as well to some extent.
And it takes away that stigma of, oh, it's just because you can't lose weight and you're not trying hard enough. And then it's like, no, I've been trying my whole life to be healthy, but I find it really difficult. And whether that be a hormonal process, whether that be a dopamine process with things like food addiction, like it is really tricky and it's really complex. And metabolic health is really, needs to be individualized. But it's transforming people so that they're able to exercise and they're able to eat healthy and they don't have that food noise and they don't crave food, and then they're not overweight so they can do the exercise and it doesn't hurt their knees, and it's this amazing snowball effect. So I'm very, pro it for the right people who need it.
Right, perfect. And I think we would both agree, and yeah, I think you mentioned as well, metabolic health is what it's all about at the end of the day. And that even I was listening to something just this morning on German TV that it'll only really work if you address the underlying issue of
Yeah.
metabolic metabolic health, i.e., insulin resistance, that you start doing it, lifestyle changes, diet changes, then it's all good. Just we are, I mean, as I'm sure you are, we are very much against that. I'm going to sit on the sofa and take the pill and get better. That's just
No,
not the way we
absolutely.
roll.
But if it helps people to make healthy choices, but you're right that we can't just take a pill or have an injection where we still eat poor food, we still don't exercise, we will lose muscle mass, you will still have the underlying, health negativity of poor nutrition. So it's also the education. So if we can catch people and do both and then wean them off, that would be the ideal scenario because obviously it's an expensive medication and people might not want to take it long term.
Okay, so let's end on a positive. I mean, 5 years. It's taken me 5 years, or probably a little bit less, but 5 years. I pulled my life completely back together from having two heart attacks. I'm pretty much where, not quite where I was before, but very good. And I just want to say, you know, is that something you see in other people as well? That you're working with people, they improve, they build back, they reduce anxiety.
Yeah, absolutely. That's the end goal, right? To be back to who you would like to be within the realms of what is possible. So if we have a new upper limit, but we're back to doing absolutely everything else below that, then I think that is an amazing outcome. If someone's, been told, right, you can crack on and do whatever you like, it's building the confidence that that is really true and you are allowed to do all of those things. So yeah, I think it's amazing. I mean, a lot of it will be a mental process as well of over time. You lose fitness, obviously, in the first 6 months because you might not be training as much. So that then takes time to come back from. A bit like, if you broke your leg, it would take a good year to get back to, running or cycling or climbing or whatever the sport is. It would take quite a lot of rehab. So similar to the heart.
Brilliant. Well, let's end on that positive note. Fabulous. Great talking to you,
Yeah,
Angela, and
you
thanks for
too,
your
Mark.
time.
Thanks for
Looking,
having me.
I forgot to ask, of course, where can people find you? Because you do one-to-one consultations.
Yep, so Healthy Hearties on Instagram. I've got a Facebook group called Healthy Hearties Cardiac Rehab, or now on TikTok. TikTok's the new platform, and it is Angela Healthy Hearties.
Brilliant. I shall put all those links in the show notes. And I'm also, just to say, I'm also looking forward to having you at our live event, which is going to take place in 3 weeks. So there will
Exciting.
also be a chance for people to talk to you and hear what you have to say.
Oh,
Brilliant, Angela. Thank you
amazing.
so
Such a
much.
good event. So looking forward to listening to other speakers as well.
Brilliant.
See you
Okay.
soon.
Take care then, Angela. That's great. See you later.